Hello everyone. This presentation will introduce you to or reinforce the knowledge you already have on discharge planning. From the time of admission until the day of discharge, most patients will agree that there is no place like home. For hospitalized patients, going home can sometimes be a little scary. This presentation will give you information on how safe discharge planning can eliminate that anxiety. Discharge planning can be defined as a joint effort between healthcare providers, patients, and patients' caregivers for a safe plan of care for patients' medical needs when being discharged from an inpatient facility to a patient's home or residence. A little history. In the early 1900s, hospitals were looked at as places to die, so discharge planning was hardly a priority. However, over time, more patients were admitted to hospitals and received care that involved costly advanced technology. As hospital costs increased, insurance companies and third-party payers began to restrict and deny some services. It became necessary for healthcare organizations to develop a discharge planning program that could coordinate care and discharge patients as quickly as possible with positive outcomes in an effort to reduce organizational costs. Some principles of discharge planning include assessment upon admission or prior to admission to determine an individual and family discharge needs, ongoing integrated, coordinated, interdisciplinary processes involving healthcare professionals, patients, families, and significant others. Every patient should receive written discharge instructions that are easy for him or her to understand. A patient should be screened to assure he or she can understand the information and the language that the information is being provided in. Identify the patient's learning needs or the patient's families and significant others. This is paramount to a successful discharge. The interdisciplinary team is responsible for implementing the patient teaching plan. Nurses will often serve as clinical case managers who will assist patients and families with coordinating any home care needed services. Assessment upon admission or prior to admission to determine an individual or family discharge needs is mandatory. Ongoing, integrated, coordinated interdisciplinary processes involving the healthcare professionals, patient, family, and significant others. Some goals of discharge planning include the following. At the time of discharge, the patient, family, and or significant others must be able to verbalize and understand the following: diet, medications, treatment, activities, follow-up appointments, and any community referral for services or equipment. The patient will receive and achieve an optimal level of functioning within a safe environment following discharge. Part of discharge planning includes assessing the patient or patient's caregiver of his or her knowledge of diagnosed disease processes, wellness, procedures or treatments needed to maintain optimum independent functioning are also important. Emotional, intellectual, sensory, and physical ability to learn and carry out treatments and procedures are needed for optimal independent functioning also. Cultural, language, or spiritual considerations need to be taken into effect for teaching and learning. Expectations of ability to comply with and adhere to the treatment plan may be done if appropriate discharge planning is provided. Assessing discharge planning needs, when done right, must be thoroughly and methodically planned. For the type and frequency of services required in the home setting, to assess for any and all supply and equipment needs. Once the patient is home, supplies must be home also. Patients who require special equipment in the home, such as oxygen, glucose testing equipment, specialty beds, specialty pads, intravenous therapy, such as hydration, TPN, and antibiotics, parenteral or enteral feedings, apnea monitors, and ventilators. Home care providers only care for the bare minimum. Home care providers only carry the bare minimum for wound care. Any wound care supplies and equipment for safe transfers and ambulation must be available for the first home visit or for the first day the patient is home. It is also important to know that caregivers are available to help with transportation, keeping the home livable, maintaining finances, and having enough food in the home for safe nutritional needs. Social work can help to secure information on community resources available to the client upon discharge. Need for post-discharge assistance or services such as involvement with a community health agency should be taken care of prior to the patient's discharge home. And you may wonder who needs discharge planning. Well, pretty much everybody. Extensive planning is required for all patients who come home, and even more so if a patient is a Jane or John Doe, they have no next of kin or other supports, they're deemed incompetent and require guardianship to assure safety, they have advanced dementia or Alzheimer's, have cultural or language barriers, and do not have financial means to provide a safe home environment. The patient must be able to afford to have access to free medications that are necessary for his or her well-being, or be able to afford the medications for his or her well-being. There must be a safe home environment with adequate heat and electricity. Behavioral factors must be considered to assure a safe discharge also. A word about noncompliance. What do you think of when you think of a patient who is noncompliant? Often, noncompliance is secondary to poor or inadequate teaching. When a patient is taught outside of his or her educational realm, it's close to impossible for them to know what's going on. Extreme noncompliance may be a symptom of a greater problem, such as Munchausen syndrome or some other psychiatric diagnosis. When noncompliance is an issue or a factor, the patient needs to be screened carefully for why the patient is noncompliant, and there should be steps taken to help avoid this in the future. Pre-admission residents known services could include being transferred from one facility to another, including nursing homes, group homes, or hospitals. Patients that are currently being serviced by other agencies are usually discharged home to the same agency. If a patient is unclear or has no known place of residence, it is important to secure one for the patient's discharge. All patients must be discharged to a residence. Homeless patients may be discharged to a residential home, homeless shelters, or other facility available in your community. Unsafe home environments must be assessed with changes made to assure safety. This can be something as simple as removing throw rugs or creating pathways in the home for ambulation. Anticipated complex medical care following treatment can be achieved on a short-term basis with continuation. Age needs to be considered for geriatric patients, especially those living alone or living without a capable caregiver. For example, it is not safe to send an elderly client home to care for an elderly ill spouse. Young children need to be discharged to capable, loving patients or caregivers. All children under the age of 18 need to be carefully screened to assure a safe plan of care can be carried out without abuse or neglect. All people need to be assessed for substance abuse, accidental or purposeful, drug ingestion, or any other behavior that is dangerous. Some diagnoses demand extra planning prior to patient discharge. These include, but are not limited to, handicapped, paralysis, or other progressive degenerative or debilitating conditions, people with organic brain disorders, anyone of any age with a history of abuse, which is physical, emotional, or failure to thrive, and having a history of multiple hospitalizations within a short period of time. It is not unusual for new moms to be discharged within 24 hours after vaginal delivery or 48 hours after cesarean delivery. Before pushing the new mom out the door, make sure she feels comfortable and competent to care for her infant or infants. For first-time breastfeeding moms, the patient can speak with lactation specialists in the hospital or prior to hospitalization as part of prenatal care. Minor parents need to have a safe environment with adequate food, bedding, diapers, and so on for her and her new infant. Special discharge planning should be considered when adoption, multiple gestations, or infant loss are involved. Pregnant women should be set up for prenatal care, have the resources available for adequate nutrition and prenatal vitamins. There is a service called Telemed that is also available through many home care agencies for moms who are at risk, have at-risk pregnancies, or are at risk for complications after birth. There are many programs available for newborns and young infants. It is mandatory that all infants must be discharged home to a safe environment with at least one loving caregiver, and someone must be available 24/7 to provide adequate and appropriate nutrition, diapers, clothing, and a safe place to sleep. And the child must also have a safe mode of transportation. Home care should be an option for patients with needs that require a skilled nurse for continued teaching, evaluating, or care. To be eligible for home care, most CHAs, or community home health agencies, require the patient to be homebound, have an acute need, and not plateau. The patient is discharged to self, family, or caregiver once the patient is no longer homebound, has plateaued, or has no acute needs. Many home care agencies have multiple disciplines available to care for their patients. This includes RNs, LPNs, home health aides, physical therapists, occupational therapists, speech therapists, and nutritionists. Many agencies also have wound care specialists to help with specialized wound care needs. PICC lines, IV medication administration and teaching, disease management, medication teaching are all part of what a nurse might do in the home care environment. Nursing can be discharged to therapy if nursing care has no more needs, but rehab does. This is common for patients who come home after total hip, shoulder, and knee replacements. Wrapping it all up, discharge planning is a very important part of patient care. Thank you so much. Have a blessed day.